So docs, what we're doing here, one of the big things you want to do with your low-level laser is stack it. So whatever modalities you're doing in your office, anytime you can stack using lasers at the same time, it just gives even better outcomes. I'm all for set it and forget it, where you can just put it on the brain or put it on whatever tissue you're targeting. But when you activate the system at the same time, whatever modalities that they're trying to improve on, you'll actually get better outcomes. So here we have Danica just showing, a cerebellar brainstem base activation with the new GVL, and she hasn't lost. That's pretty darn good. 33 seconds. So
okay, all right. It's been a while.
Yeah, it's been a while. So Danica is in the top of the records here as far as the eye-hand coordination and eye speed or hand speed. So we'll go one more. We'll give one more round of that.
Hang on, you got to take a deep breath, right? Take a deep breath.
Let me go back to, there you go. 4-4-8 breathing, that's another big one. So there we go. All right, so Danica, whenever you're ready, go ahead and hit. There you go.
Same thing. God, those couple at the end.
Yeah, when that thing's super sensitive. So, all right, so we'll go show some base brain master protocols. So this is the new GVL. This is Erchonia's newest device. It's got the green and violet wavelengths, and so one of the things that we're understanding in laser physiology and light therapies is the different wavelengths have different functions in the human body. A big one is the mitochondria, and so what we're seeing now is the energy failure model of healthcare is major in pretty much all conditions. You need energy to heal, you need energy for optimal function, but especially the brain. If you think of the central nervous system, it is using up upwards of 30% of your energy, oxygen utilization, blood flow, things like that. So what we're finding in the newer research is the green affects the mitochondrial function in a certain way in what's called the third complex. The violet hits the first and second complex, and the red hits the fourth complex, and those are all rate-limiting enzyme complexes. So when you have all three wavelengths, you check off every box. A good example right now is what we see in that model is Alzheimer's, you need all three wavelengths. ALS, you need all three wavelengths. Autism, you need all three wavelengths. So there's certain conditions that having all three in your repertoire, like your base station, I highly recommend docs when they're investing in lasers that they invest in a base station and they have a red violet, the EVRL, and the new GVL, the violet with the green wavelength, so that way you can cover every element of that. So with Danica, what we're going to show today are a couple essential things. So these are the kind of things, I don't care what your brain condition is, if you're just looking for everyday toning, brain neurodegeneration prevention, if you're working with post-concussion, Alzheimer's, whatever patient type you're working with, this next setup is going to be absolutely critical. So the big areas of the brain that need the most energy are going to be, as a general rule, is the prefrontal cortex. Your frontal lobe is what makes you executive function and cognition, and what separates you from lower life forms, so to speak, as far as your with that activity. And so it's something that we want to make sure is healthy and is activated. Another big one is the cerebellum, the little brain as they call it, and that's at the base of the skull here. So you're going to notice I'm going to do two major points in that therapeutic realm. And so Danica, this is something that you could do pretty much every day, like if you're going into a podcast, if you're going into a recording event or whatever, just to get your brain optimized. But also for, one of the holy grails with brain is new neurons, the neurogenesis, as you talked about in the podcast. And some of the ways we know how to do it, low-level laser at the right dose can actually promote nerve growth factors like BDNF, and it can promote biogenesis of neurons. So neuron formation is like one of the main things that you want to obviously accomplish. We lose neurons all the time, so what better than to have as a modality for the brain, make new ones. So lasering the brain will do that, but we also know that 40 hertz frequency is absolutely critical for that. If you read, just Google like what MIT is doing, what all the Boston area studies are doing on 40 hertz, has all these far-reaching effects. 10 hertz has a very good parasympathetic vagal effect. 1 hertz has a very good hemispheric and subcortical communication. So what we do in our master brain setting, and I use this on about 70% of my patients, it's 1, 10, 40, and 60. So I want all the docs watching to make sure that's your master brain protocol, 1, 10, 40, 60. And you can pretty much default to that, even when we're doing pain management. I'll expand on that more later. So with that prefrontal cortex, one of the other things that study shows that if you meditate, you'll also promote neurogenesis, especially in the hippocampus, that memory area where neurodegeneration starts. So meditation is a huge thing, and so what I'll do is I stack them. So what I'm going to show with Danica here is, I'm just going to have her close her eyes, and whatever form of meditation works best for you, so then you just activate in the prefrontal cortex, and this is where stands come in handy. Danica has her stand at home that she can set this up, and just set up the laser to hit the prefrontal cortex with that 1, 10, 40, 60. Now with the violet and green, one of the very cool things about that is those shorter color ends of the visible spectrum have more energy. So violet laser has the most energy of all the laser sources. It can activate your atoms in your cells to reach higher orbits to create that energy mechanism. Green is the second most powerful on that, or not, I don't want to use the word power, it's got the second most energy, and red has the third most. So when we do the violet-green together, that's giving Danica's frontal lobe all kinds of great energy and blood flow to the brain and new growth factors and things like that. So what I like to do, and I do this on my lunch hours, I'll stack doing 1, 10, 40, 60 to the prefrontal cortex, and we'll do about 3 minutes with this red-green of meditation. So we'll just go into that nice relaxed meditative state. And now you can also use this in, for example, depression. There's lots of studies with lasers and depression. Depression also tends to have a right hemisphere, right frontal bias. So like just to tweak this a little bit, if I'm working with a depression patient, I'm going to move it just a little bit more to the right prefrontal cortex and then have them think happy thoughts. Our default mode network, our salience networks, the things we default to, if we're constantly thinking negative, 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 that actually creates plasticity, and that builds up in the brain as your default mode. So you can, if you're thinking positive thoughts, you'll actually change your hardwiring to have different perception of your life, that your stressors in your life and things like that, and even manifest stuff, getting into more of what's putting that stuff out there, as they say, putting good thoughts and good vibes out there to attract that to you. So one of the things we like to do is even do a slight right bias of the prefrontal system while we use that 1, 10, 40, 60. Now, as far as my moving over from the rest of the brain, with these higher energy devices, the GVL, I do 3 minutes per section. So I'll do 3 minutes prefrontal cortex. Now, if you said to me, Doc, just give me 2 spots to do on the brain, I'm going to go prefrontal cortex for half of it, and then I'm going to do brainstem cerebellum for the other half. Because the cerebellum, the more we study the cerebellum, the more we're seeing it's absolutely critical for brain health. It's not just about muscle tone and balance and coordination. It's for planning movement stuff. It's for, we're seeing it involved with immunology and pain management, and the list goes on and on. There's a reason why over half the neurons of your entire nervous system sit in the cerebellum, and it's also the reason you need to move. Exercise, all that muscle feedback drives into that. So I'll do cerebellar-based stuff. And so maybe what I'll do is Dr. Woolner, I'm going to have you just go ahead and set this up behind me for me on the stand. Or Dr. Woolner can be a very expensive stand for me. That's right. He's a very expensive stand. So this is a good time to do things where you're actually activating the muscle system. So one of the things you may want to do, you're fine with just having the patient sit there and get that absorption, but this would be a good time to do different things that we commonly use in neurology. For example, we'll do some finger to nose stuff. So Danica, what I'm going to have you do is you're going to touch your nose, and then you're going to touch my finger, and we're just going to do that as fast as you can, and just keep going. So you may want to stack with modalities like this, or maybe a good thing for like AD, good job, nailed it, ADHD, OCD behaviors, things like that, where they're overactive brains, we'll slow them down with what we call go, no-go exercises. So just like the simple game we all played as a kid, like Simon says walk, Simon says stop. This is a really good thing to stack. So Danica, I'm going to have you put your hands on your lap. Now if I say Simon says right, you're allowed to turn your right hand over. If I say Simon says right again, we'll turn it back over. And obviously if I say right, we're not going to do it. Okay, so Simon says left, right, Simon says right, Simon says left, left, And see Danica, brain working great. She was able to inhibit all of that stuff, but you can do this stuff, you know, just whatever modalities you use. Say you work with therabands. This is a really good time to do, say, isometrics, for example, with therabands. It's another common thing we do. But when you do coordinative complex pattern while you're lasering the brain, you're going to get even better outcomes with that. The third spot that my expensive stand is going to move to is we're going to go apical. So your base brain protocol for this is your default for Danica's going to be doing this. Any docs that are working with laser, we're going to go 2 minutes prefrontal with the GVL or EVRL. We're going to go 2 minutes apical parietal, and then we're going to go 2 minutes cerebellum. That's your base brain exposure protocol. Then what we do is we always want to communicate that brain-gut axis. And so we've done studies and we see it objectively in the clinic with heart rate variability and pulse oximetry and whatnot. You can laser the vagus nerve as it runs right along here. The vagus nerve loves a 10 hertz frequency. The parasympathetic system loves a 10 hertz frequency. So that's one of the reasons we've got that baked into that master brain setting, 1, 10, 40, 60. So we'll go 2 minutes here minimum, and then we go 2 minutes over the gut minimum. Okay, so that is your base toning protocol. So it's 2, 2, 2, 2, 2 with the master brain frequency. If my attendants just did that, then you would make a huge change in the neurology of this country. So that's your setup there. Now, another thing I want to do while Danica's seated is we'll talk about some pain management stuff because, you know, as an athlete, as we're training, certain injuries happen. And so what we want to do is most of your patients are going to do well with just the set it and forget it. So let's just say Danica strained her shoulder or something, you know, doing her red wine, you know, maybe drinking yeah, exactly.
Happens
so
every time.
Do you got a Magnum? Do you guys do 1.5s?
Oh, yeah.
Okay,
Yeah,
so
sure.
the
3 liters.
Yeah. Oh, do you really?
That's real heavy.
So
That's where you really strain it.
The 3 liter somnium strain there, we'll call it. So most of your patients are going to do well with just set it and forget it. I always give myself minimum 6 visits for just a basic pain, musculoskeletal. For more complex stuff, like when you're working with neurodegeneration, always give yourself 12 visits as a treatment trial, just to see what kind of changes you can make in that patient. Now, when we do the laser studies, like the FDA clearances and whatnot, we don't get to move the lasers around. It's a set it and forget it, and you'll see the Erchonia products knock it out of the park. So like about, you know, the old 80-20 rule, about 80% of your patients are going to respond well just by lasering this area. Now, one of the interesting things, some of our docs, like Dr. Garrett Silverman, they just did the GVL pain study. This green-violet laser did even better than the red and the violet-red laser. Had the best pain outcomes, had the best range of motion improvement. So those studies are now published, and that was great outcome. So the GVL for pain management is a very important tool to have in your arsenal. So 2 minutes, set it and forget it. But I also want to show the audience just how we work upstream. So if we're not quite getting the results that we want out of the shoulder exposure, then what we're going to do is trace the nervous system up into the central nervous system to see where along the way the body gets the best results. So let's just say hypothetically Danica's having pain on abduction, and as I laser it, maybe it's still not moving as well as it could. Well, as a doc, what you want to do is take your laser, after doing a couple of minutes exposure there, and go spinal cord nerve root. So now I'm lasering her cervical plexus and cervical spinal cord. So I've got the violet right on the spinal cord and the green off to the nerve root on the side. And then what I'm going to have Danica do is then retest. And I can see, well, maybe that's what brings it up higher and less pain. So now you know as a physician, you're going to maybe bias maybe to more of a cervicogenic or neck-based therapeutic activity. Next thing we look at is vagal tone, for example, and that's the vagus nerve does really good with pain inhibition. It does good with septic inflammation. It does, you know, so you can use vagal nerve stimulation. It fires right into the area of the brainstem where you make serotonin output for pain inhibition. So it's called the Raphe nuclei. So the next thing we'll do is a couple minutes of vagal nerve stimulation as part of that upstream, both diagnostic and therapeutic endeavor. And then we retest the shoulder range of motion and pain level. Next thing we do is we go, oh, look at that, so the vagus nerve works, so perfect. Next area we'll do is the cerebellum. So then I'm going to laser the cerebellum, that base, you know, right behind the ear there, kind of at the brainstem base of the skull area, and see if that is the component, because the cerebellum will start to adapt or maladapt in pain management. It'll start to create changes in tone and movement strategies that have to be undone. Next thing we do is we do parietal base. So then we're going to go up to the sensory part of the brain that some pain terminates in the parietal lobe. Not most of it terminates in the brainstem, but about a third of it, give or take, comes up into the parietal lobe. So then we'll retest with doing parietal lobe-based stuff. And last but not least, then we'll do prefrontal system. Again, looking at that, how the brain starts to have fear responses and limbic responses to pain. Like patients will like, oh, I don't even want to think about sitting down or standing up because I know it's going to hurt. And that becomes a very limbic prefrontal type tie-in with that part of the system. And again, that default mode system. Now, that's your upstream, both therapeutic and diagnostic protocol for pain management. Now that could be a knee, a big toe, it doesn't matter. You just work distal tissue, brainstem, spinal cord, vagus nerve, cerebellum, parietal lobe, and then your frontal system. And a couple minutes at each. We have a rule of 2 minutes at each section. But here's the big one that I want all the docs to really make note of on any pain management stuff is what we call our downstream protocol. And what that is actually start at the top and I work my way down for a therapeutic endeavor. So let's go back to Danica's shoulder issue here, for example. And so now she's feeling tightness, restriction, pain on abduction. The first thing I do as a healthcare provider is I'll take my laser, I've got my GVL. Now I'm firing to her left prefrontal system, which controls that cortical spinal, to fire the right shoulder movement. What I'm going to have Danica do, in this 2 minutes that I have it here, I'm going to have her visualize. I say, Danica, I want you to picture that shoulder moving free of pain. I want you to picture yourself playing tennis or any sport maybe that she's not able to do. Have her get a positive image reinforcement while you're lasering her prefrontal system, because that will start to wind down that limbic response. Instead of her thinking, oh my God, as soon as I move my shoulder it's going to hurt, you get her thinking, oh, this is going to be beautiful. I'm going to be able to move my shoulder freely. It's going to be without pain, things like that. So I do that in that 2 minutes that it's there. The next thing I do is the contralateral parietal lobe. Take a massage device. This Erchonia percussor is the most brilliant tool for this. It's super comfortable. It feels really good. I like that 2-inch black pad on there. So what I'm doing is I'm starting to create large diameter integration on Danica's feedback loops. So what I'll do is as I'm lasering her parietal lobe, I will vibrate and do massage on the shoulder area, and now we're starting to create those sensory motor feedback loops so that she gets better appreciation of that limb. Because one of the things when a limb shuts down, we start to lose neurological integration. We start to lose neurological integrity. So there we go. We can stop right there maybe. So maybe that's all it took was those 2 mechanisms. Then as we continue to swim downstream, we're going back to that cerebellum that coordinates plan movement and muscle tone. So I'm going to take Danica's shoulder as I'm lasering her cerebellum, is I'm going to move her shoulder in a passive complex, like a figure 8 pattern, or just some sort of passive complex movement like that, because that starts to reset that maladaptive strategy. So here we go, and I'll do that. And each of these, again, is 2 minutes per setup. Next thing I'll do from there is my vagal nerve stimulation. This is a good time to do your 4-4-8 breathing or different types of breathing patterns like that, just to get oxygen in the system, to get you into more of that resting, digesting, healthy component. So then we go 2 minutes there. Then we go 2 minutes nerve root spinal cord. And this may be something, maybe you stack with an isometric. So maybe I'm having Danica gently push her arm out against my resistance and holding like that. So again, off and on for that 2 minute period. And then lastly, then you go to the tissue exposure. So 2 minutes right over the shoulder, or if you're working on an elbow, a knee, or whatever. Very few cases. If you've done all that downstream neural laser approach, there's not too many cases that you're not going to help out with. If not, if you're still refractive in that setting, one of the things for consideration is that maybe you need imaging. That might be a good time to look at doing advanced imaging like an MRI or something like that. Now again, you're always going to give yourself, like I said, a minimum of 6 visits, even with like a basic orthopedic condition like that. So we've talked about upstream and downstream, both diagnostics and therapeutic. Last thing I'm going to do when I've got Danica here is I'm going to have her lay on her back. I'll get this out of your way, my apologies. And so if we did a supine, say you've got like an acute TBI or something like that, or a patient that needs to just lay down and relax in this setting, what I'll do is I'll do this. I'm fine with doing the 6 minutes here with the GVL to the prefrontal system. And then what I'll do is after I've done 6 minutes, again, she can do the meditation, the relaxation, breathing stuff, things like that. We'll do the vagal stimulation, but one of the things we like to do as part of that brain-gut axis that is a really good call is to actually massage the stomach. So I'm going to go ahead and laser, as I'm lasering the vagus nerve as it runs along the SCM, I take my percussor and I go in a clockwise direction about 3 or 4 laps around the track. So now I'm activating the input of the vagus nerve. So there's over 5, some studies show as high as 9 times as much information goes from your gut to your brain. And so I'm activating now in a duality. I'm putting the laser on her vagus nerve as it runs along the neck, and then I'm massaging the gut. And then lastly, I do at least 2 minutes over the gut itself. That's good for again, that visceral feedback and the gut microbiome, all the good bacteria that's in this area. So that is a really good, downstream supine approach. And one of the things that we like to do with Danica when we're actively treating her is, go ahead and give me some glasses there, is if you have other devices, you can stack them. So I'm going to put this on here. So maybe you're using an FX while I'm doing, say, the gut exposure. Then you can use one of your other devices like an FX and do the brain exposure. So now I'll have those same master brain frequencies, for example. Janelle, can you give me glasses, please? Sure. And I'll do the master frequencies. Well, I like to, on the FX device, I'll do 1s and 10s as part of the vagal cerebellar activity here, and I'll do mostly 40s and 60s up in these apicals. So we got our master brain. Now, these devices are safe enough that you can use in a setting of get eye exposure. As a matter of fact, we've started teaching retinal exposure. Now, I'm going to be very careful when I say that because I don't want to just say that indiscriminately. But if your patient or you as a staff member get some incidental exposure, you don't have to worry about it with these devices because they are low level. So one of the things that I would like to finish with Danica when we're treating is I would do brain exposure with the FX, and then I would do handheld over her gut, do vagal stem, and now you're stacking this all at the same time. What a great 1-2 punch for that brain-gut axis. So again, master brain frequencies, 1, 10, 40, 60 on both cranium exposure and then using the gut. And again, if you're using something like the GVL, I'll do at least 2 minutes on the gut, 2 minutes on the neck, and now you've got a great overall tone for working with different conditions, anything in neurology. I'll use this in pain, I'll use this in neurodegeneration, like when I'm working with patients that have Parkinson's or Alzheimer's or things like that, post-concussion syndrome, and the list goes on and on. So that's just a really good default combination there. All right. Danica.
Very relaxing.
It is, isn't it? You'll see in our office, people, our whole staff, we're using up, what, 10 lasers here now? And you'll see our staff all being utilized, fighting over the different lasers, and you'll hear people snoring when patients are in here and that kind of thing, because this is their place, this is their meditative state. So, all right. So Danica, I'm going to let you. So I know Danica's busy schedule. All right. So as we continue with our new GVL, the violet-green Erchonia laser. We're seeing that the green also, even though there's going to be a lot of research coming, there's not as much research on green yet as there is, especially on red has the most research, and violet has a lot of research now as well. As green picks up steam and as it gets more clinical applications and research applications, you're going to see more and more uses of it. In particular right now, one of the things we're seeing with green is bone healing, bone fractures. That's going to be your best device is your GVL. So the bone frequencies that we use are 20, 45, 9, 8687, 8,687. That's a good default bone frequency to use. And basically what you can do with that is just point and shoot. It will go through a cast, so you can use it on that, but there's also a scopal effect. So even if Chad here, my patient, has a broken arm, I go right through the cast with it, but even if I laser the rest of his arm, or even anywhere on the body, it'll actually have a systemic healing effect. I can laser his opposite arm and speed up the healing time on this arm. So with that, we'll typically do at least 6 minutes to 10 minutes when we're doing bone healing. Like if I'm going through a cast, I'll typically do a 10-minute treatment on that. So that's just a simple point and shoot with, again, the 20, 45, 9, 86, 87. Another big one that I use a lot with the green is that showing green is really good for the peripheral nervous system. peripheral nerve injuries, things like that. So I'm fine with using kind of the default musculoskeletal setting on that. The 9/16/42/53 is a big one that you'll see in Jerome's book and in a lot of your laser settings. Another one, I'll use my master brain that I talk about, 1/10/40/60, but there are multiple studies that show 2 hertz frequency is really good for the peripheral nervous system. So on all of my devices, I have one setup that I call peripheral nerve, and it's just 2/2/2/2. All of the diodes are set at 2 hertz. So let's say Chad's having a peripheral neuropathy, and I want to laser that nerve distribution. Well, actually, we'll do it on this side for the sake of the camera. I'll laser that common peroneal area for at least 2 minutes with that setup. And then I call this what I call the gate protocol. So I'll do 2 minutes in the common peroneal as it comes through that tib-fib area there. And then I'll do a couple minutes in the tarsal tunnel. So that's on the inside element underneath that medial malleolus, that bone right here. So I'll do 2 minutes there. And then I'll do 2 minutes right on the plantar division as it comes there. Now you can still swim upstream, even with peripheral nerve activity. But for peripheral exposure, using lasers on the nerve distribution, you can still do nerve root and spinal cord upregulation. You can always stack with your, doing your vibration devices. So let's go ahead and lay on your back, Chad. So a good way to do this would be to actually have your device on the stand, and I hope you all do invest in the stand. It's definitely worth it to be able to have that mechanism to hold it. So in this one, say I'm doing that, say he's got diabetic neuropathy or small fiber disease or something along those lines. I like that 2/2/2 setting. With this one, the massage, I'll do the highest level of vibration and I'll co-activate. So I can do vibration on there at the same time to help blood flow and help to activate those large diameter nerve fibers. Another good thing to do would be to stack it with the motor activity. So Chad, go ahead and pull your left foot towards your toes towards your nose. So now he's actually activating the muscle system. You see how he's pumping like that. So we really like that green-violet for peripheral nerve activity. And then when I move it to the tarsal tunnel or plantar area, so I'm moving the laser there, maybe I'm going on the bottom of the foot and having him gently push down towards, like he's pushing on a brake pedal. Okay, and again, I do at least 2 minutes on each section, and then I'll move the laser down and hit the bottom of the foot for the peripheral nervous system. A good rule of thumb, anytime we're doing segmental stuff like this, just default to 2 minutes each time. 2, 2, 2. Now, it also doesn't matter, don't get too hung up in the order that you do this kind of thing. If you're going, throughout the nerve, you can do the plantar, then the tarsal, then the common peroneal. So again, green violet laser, the GVL, that's the main default that we go to for a peripheral nervous system now. And audience, I don't want you thinking that your red or EVRL lasers are not effective in these. They're very effective tools. It doesn't matter what Erchonia product you have, but if you're looking to add something to your practice, for sure get that GVL, or even better, get the base station and have that GVL as your primary tool in office, and then rent out your accelerate. That's what most of my doctors are doing now. We do it. We've had our lasers, we've had our EVRL rented for the last month to the tune of, it was about $1,600. So, you're making your base station and payment and beyond just by doing your laser rentals. So there's a huge demand for laser rentals, and I think that demand is just going to continue to grow. And so with having a base station in your office, get one red, the accelerate, get one EVRL, the violet red, and get one GVL. It's the perfect trifecta combination. And I know a lot of times the company will do like base station build-up, so Penny can talk to you more about that when she talks to you about at the end of this video, because she's going to give you some great ideas for how to get into one of these for every practice type. How to, whether it's through financing, and how to grow your practice with lasers, because it's not just about patient outcomes, it's about running a good business, and these things can be great profit centers, and so having that rental program is very beneficial for that. And Penny is the best on the planet on how to monetize and help with your laser outcomes from a financial and marketing standpoint. Okay, next thing we're going to do. So we talked about bone, and we talked about peripheral nervous system. I love the green-violet laser for immune regulation. One of the things you see with green in literature is that it's a very good adaptogenic thing. So if your immune system's too high, it'll help calm it down. If your immune system needs boosting, it'll help promote it. Having that green-violet combination is one of the main things I'm using with, say it's a chronic pathogen patient, like mold or Lyme or long COVID, things like that. I'm using the green-violet combination quite heavily as my go-to for this. Now, again, anytime you're doing immune regulation, you always want to think gut health, right? So the immune frequencies are 20, 73, 465, 728. And again, that one's in Jerome Aruca's book. You can always use that as a reference guide. And so that, and what you'll have, and for those that aren't familiar with these devices, it's pre-programmed. I've already got it built in. I've got my immune setting. So whether it's you or your staff doing it, you just go to the home page, use your protocols, and you'll see I have immune already one touch of the button built in. All I got to do is hit start. Easy as that. So you've got all this stuff pre-programmed in, doing immune setting. Now, again, looking at it from, I typically do what I call my immune half. I'll always do transcranial. That's one thing I'm doing with basically every patient that comes in my office. Because when you think of immune regulation and brain inflammation and prevention of neurodegeneration, when the immune system is when it's attacking something, it uses inflammation to do so. Now, we need inflammation. We need it. Like if you're fighting off a cold or a flu or whatever, you need that initial inflammation. What's happening in our country, though, is people are under chronic inflammation. And so we have to turn off that fire. We have to put out that fire. So lasers are arguably the best way to do that, other than getting rid of, whether it's a virus, a bacteria, a food source, that kind of stuff. So to that point, we always laser the brain, we always laser the vagus, and then we go down into the gut. Now, in this setting, you can definitely use your stand and move it piecemeal. But because I want a lot of exposure, one of the things you may see me doing with my GVL is I'm actually wanding. So I'm actually working all the way up. So Dr. Wollner can move his hands to the side. So I'm going to wand it all over the gut area. But I'm also maybe going to be doing the lung field, the thymus, for example, in that sternal area. So I'm wanding in through this area and then getting into that vagal stimulation again. So at least a good 5 minutes we do with the whole respiratory system, GI system into the vagus nerve. So we'll go about 5 minutes wanding this whole area. Now again, don't worry if you're doing a stand, set and hold while you do other stuff with the patient. And then lastly, just in standard protocol, we'll do up to 6 minutes. Anytime you have a violet laser beam, we'll do up to 6 minutes treatment to the brain. So if the patient's relaxing, we've done this whole respiratory, GI, vagal system, I'll let them still rest face up for a good 6 more minutes with the GVL or EVRL or FX405. All right, so that is a good immune protocol. And again, those frequencies are 20, 73, 465, 728. I'll use that in my long COVID patients, I'll use that in my mold patients, and the list goes on and on. Any chronic immune overactivity, or if the immune system's getting taxed, then I'll use the violet, the GVL with the violet and green combination. All right, lastly, we'll go ahead and, actually I'm going to show one more thing. I showed this in the last time I did my live webinar, but I think it bears repeating because a lot of patients that are coming in with dysautonomia, say it's post-COVID, POTS, things like that, we want to actually be able to do autonomic regulation stuff. Now this gets a little more complex. This is not as easy to just point and shoot or swimming upstream or downstream. This you actually need certain modalities in your office for dysautonomia. But for those watching that are dealing with POTS patients, which is where as a patient lays down and then they go to stand up, there shouldn't be this massive spike in heart rate and massive drop in blood pressure, that kind of thing. So if the heart rate goes over 30 beats per minute higher from when you're laying down to standing up, that's called POTS, postural orthostatic tachycardia syndrome. And a lot of our patients that are suffering, that are mold sufferers, Lyme, long COVID, things like that, is that they're suffering because they're having that dysautonomia. They're suffering because when they go to stand up, their system crashes. And I won't get too technical on this, but it has to do with what's going on in brainstem regulators and the cerebellum and gravity pulling down on your vestibular system and whatnot. So I just want to show you the technique that we use for that. It's called a tilt table clearance. And so what we like to do is activate the cerebellum using good core proximal muscle groups, especially glute external rotator or hip external rotators and hip extensors. So what I'm going to do is I'm going to put this TheraBand on Dr. Wollner, who unfortunately we'll just say for the sake of this video that he got long COVID and he's having like really fatigue when he tries to stand up. He can't just get through his normal day. He's getting lightheadedness. He's getting, heart rate changes, things like that. Watch for this, because what I'm going to do is monitor his pulse ox. And so with this one, you can simply look at heart rate. So any pulse ox will do, $30 pulse oximeter with it. I don't even need blood perfusion index necessarily on that. So as I'm looking at his heart rate, what we'll do is we'll get our baseline. And then how the therapy works is that you'll notice when you do tilt table assessment, as I bring the patient up, the foot piece will come up, there will be a point in that elevation that you start to see that major spike in heart rate. And so what we do as clinicians is we monitor his pulse ox, and let's just say hypothetically, this is where he starts to get that big spike in heart rate. What I'll do with Dr. Woolner is I'll have him go ahead and use your glutes to push the band apart. So you do a glute isometric clamshell. Next thing you do is stimulate the vagus nerve. And again, I'm having even better success with my GVL with this than I was with my other handhelds. So I'm doing GVL to the vagus nerve, and I like to do the right side in this setting because that's more heart rate based modulation with the SA node in the heart with the INL. Don't worry about those technical terms, but we just do the right side. As he's holding a glute isometric, we're going to activate his gaze stabilization centers, and that has to do with what the brainstem is doing. So I'm going to have Dr. Wolin just pick a target on the ceiling, and what you're going to do is a small no-no head movement for me, just like that. So he's going to do that no-no head movement while I'm lasering the vagus nerve, while he's activating the cerebellum with isometric, and stop. And he's only going to do, depending on his fatigue, no more than about 8 seconds, maybe even 5 seconds of that no-no. Once he's resting, and you'll notice if you're monitoring his heart rate, when that's working, say the heart rate spiked up to 88 and you start to see it drop back down, that's perfect. That's what you want. It's kind of that wax on, wax off with heart rate variability. So then when he's resting from the no-nos, I'll move the laser down to his gut, and I have him do 4-4-8 or 4-7-8 box breathing in the break. So go ahead and breathe in through the nose for 4, hold it for 4, and out the mouth for 8. So I give his brain a little bit of a rest in the brainstem. Now, I may have to stay at this level for now, or I may bring him up to the next level. So maybe I go up another few degrees, and I'm monitoring again his heart rate. Okay, if it's spiking again, give me that no-no, give me the glute isometric, and nice and small and slow, perfect. Good, as I monitor the heart rate, we'll go ahead and relax, give me the box breathing, relax the legs as well. And then what you do is you gradually build the patient up, and once they can tolerate higher and higher levels, eventually you get them full upright. Now we'll do other therapies like off vertical axis rotation, things like that. Don't worry about that for the sake of this video, but just be aware of this. So if you have maybe an activator table or a high-low that has tilt like this and that kind of thing, is that you can use this. So you assess for it, what's their heart rate here, and then you measure it at different points all the way up, and then you use that therapeutically. You need to exercise these patients below that tolerance level. It may be here, it may be here, and then you build them up for that. So that's a really good gem to use with the GVL. So I'm going to let the patient back down. And lastly, for this webinar, I'm going to show you the advanced autism protocol. And so what we like to do with that is that the newer studies show that we do need that third, component of the mitochondria. So autism studies show that we need in the prefrontal system and temporal system, we need that third component, which is the green part of your mitochondria, if you will, and the cerebellum with temporal lobe integration. So what our advanced autism protocol is that autistic kids, now again, I'm very careful because it's never just linear, okay, they're right brain, left brain, things like that. But as a general rule, autistic kids have right hemispheric deficiencies. And so what we like to do in our office, this is our base go-to for that, and we also need delta and alpha band setup. So one of my autism, my advanced autism protocol is, it's actually built into my laser as rest digest. And what that is a 1-10, 1-10 setting. That is your advanced autism protocol, but it's also a rest digest. Remember, the parasympathetic system loves a 10 hertz frequency, and the slow delta wave stuff is a nice restful state, like deep sleep, things like that, but it also causes a lot of like interhemispheric communication, sensory processing, sensory integration, things of that nature. So we use those two frequencies as our primary go-to. rest, digest, or you can even call it your autism setting in your laser. That's fine. 1, 10, 1, 10. Now this is advanced. Keep in mind, I'm not diminishing. When we did the initial autism study, it was just the red laser that did it, and it had remarkable results. So you're fine with just doing red laser to the brain and you're going to see positive changes with your autistic patients. But with that said, we teach a lot of advanced stuff in our seminars. So what I do is, and when I use my violet beam in any capacity, whether it's an EVRL or GVL, I do 30 seconds per year of age as my transcranial activation. So if a baby's 2 years old, I'm going to do 1 minute to this transcranial. And what I like to do for my first minute here is I do his right hemisphere bias for frontal temporal lobe integration. So I'll hold the beam here. So I'm kind of hitting that prefrontal cortex and it's kind of wrapping around like that. So that is my go-to there. Now, I always like, as you guys have seen in my training, I always like to stack stuff. Autistic kids love like heavy blankets for a reason. That right parietal lobe is very good. How we stimulate that is deep, heavy stimulation, like hugs, heavy blankets, things like that. I may be using my Erchonia percussor as a good example, where I'll actually massage their left leg to activate that right medial parietal lobe with a deep massage. And it's kind of interesting. I always think this is cute. My autistic kids, when they see this massager and the laser, they'll actually grab it and start to massage their own leg with it and that kind of thing. So it's kind of neat. So I'm stacking it. I may be doing, left-sided body massage stuff if they can tolerate it, depending on their sensory processing. Maybe I'm doing left-hand cerebellar complex activity while I'm doing that. Marching stuff, timing stuff. There's different ways you can activate the system. So I do, again, so we're talking about a 2-year-old, so I did 1 minute here, and I'm going to do 1 minute in his left cerebellum, left temporal lobe area here. I know you can't see that on the camera, but I'm behind the ear, and I'm kind of bringing the laser around to a little bit more into his temporal lobe. And same thing, I may be stacking that with like a dual task movement. I may be stacking that with a figure 8 movement with the arms and legs, cross pattern stuff, interactive metronome, things of that nature. So that is your master advanced protocol. Again, just as a quick review, 110, 110 with your GVL. You're going to do right prefrontal temporal lobe for, again, 30 seconds per year of age. And then once you reach that 6-minute mark, you can just cap it out on there. So we'll do 3 minutes here, 3 minutes here. And then, so I do the 3 minutes up to that age group on the prefrontal temporal lobe, and then I'll do 3 minutes in the left cerebellar into the temporal lobe on the contralateral side. So typically we're doing right hemispheristic activity. The left cerebellum very heavily drives the right hemisphere. That is your advanced autism protocol, stacking it with things. We're always looking at nutrition, gut barrier stuff, things like that. I do like the brain gut stuff too. So in all my autistic kids, after I'm done with the brain-based applications, or before, it doesn't matter what order you do it in, I'm definitely doing vagal nerve stimulation with them as well too. So again, I'll do a couple minutes along the SCM here, and then I do a couple minutes over the gut, and that's a really good laser protocol. So definitely use your new GVLs. I know a lot of you are investing in this technology. It is phenomenal, and I think as you continue to see the research in the peer-reviewed published activity, you're going to see more and more with green diodes. So the beautiful symbiotic activity when you've got a red, green, and violet, and I expose my patients to all 3 wavelengths, you've checked off every box that you need for mitochondrial output, and it's a great advancement in the laser neurology realm. So thank you all for this webinar. It's always a pleasure to get a chance to talk with everyone, and obviously get out to one of our seminars. Go to erchonia.com. We'll be doing more. We teach these advanced protocols. There's a huge interest in looking at what you can do with neurology, no matter what your practice is. These are great for pain management. Like we said, one single treatment with this, the GVL had even better outcomes than the red, and the red violet had amazing outcomes with just neck and shoulder pain, things like that, but the GVL is doing even better. So no matter what your specialty is, I highly recommend advancing into your brain-based applications. I don't want anyone not getting the benefits of an Erchonia laser to the brain and all the other neurological implications. For those that are more interested in learning more about this, if you go to erchonia.com, you can see myself teaching and some of the other docs that teach neurology, like Dr. Brock, Dr. Murphy, things like that, and some of the other teachers are adding more of this to the repertoire as well. We're also announcing we're going to be launching a project this year called AFN, Applied Functional Neurology, and I'm super excited about this program because Dr. Wallner here is actually the CEO of that program. We have the entire team here recording this week because we are finally, I have a way to, all the docs that come up to me after the seminar say, Doc, I love this, I want to implement it into my practice. How do I do it? I didn't have the infrastructure and the systems to do that. Well, now with the AFN group, we are putting together a platform that you are going to have that ability to start to integrate these neurological principles into your office. So watch for that in 2023. We're going to be launching that this year, and we're super excited about it. So thank you again for everyone attending. Be sure to stick around. Penny's going to give you some information on how you get one of these awesome new devices into your practice. And like I said, really consider getting a base station if you don't already have it. Thank you.